profile of Brent. Let's start with where Brent is located. Brent is a borough in northwest London. It is the 5th largest borough in London and the 30th largest in the whole of England. Brent Council 2022 and 2025 states that Brent shares borders with several other boroughs: Harrow, Barnet, Camden, Westminster, Ealing, Hammersmith and Fulham, and Kensington and Chelsea. Brent is also one of the most densely populated areas in London. According to ONS 2025, it covers about 36.9 square kilometers, and in 2025 there were around 8,164 residents living in every square kilometer. That is a lot of people living close together, and this matters for health and social care, because dense populated areas usually need more local services. Looking at the future, population growth is expected to be strongest in a few specific areas: Alperton, Wembley Park, Roundwood and Northwood Park. According to Brent Council 2023, this growth will increase local demand for housing and for health services in those parts of the borough. So in short, Brent is a busy, crowded, growing part of the northwest London, and this geography is the starting point for understanding the health issue we will talk about later: type 2 diabetes. Now let's look at who lives in Brent. According to ONS 2025 and Brent Council 2025, Brent has a large and growing population. In 2024, there were around 353,000 residents recorded. In terms of age, Brent is still a relatively young borough, but something important is changing. The number of older residents has been rising faster than before, especially between 2011 and 2021, Brent Council 2025. This matters because older age is one of the risk factors for type 2 diabetes. Brent is also one of the most ethnically diverse boroughs in London. Brent Council 2023 states that the Asian British and Asian Welsh community forms the largest non-white ethnic group in the borough, accounting for around 112,000 people in 2021. Why does this matter for our topic? Because age and ethnicity are not just background facts. Some ethnic groups, including South Asian communities, have a higher genetic and lifestyle-related risk of developing type 2 diabetes. So, when we combine a growing older population with a large South Asian community, we can already straight to see why diabetes is such an important health issue in this specific borough. Now I will hand over to Roberto, who will talk about the social economic condition. Thank you.
Okay, now after saying where and who live in Brent, we can speak about how they live. They don't live so in good condition, and this infographic can speak very clear the economical condition of this borough. In 6 years, has improved about more than 20 places to the wrongest position, because they, from 49th place, they have gone to the 22nd. And be careful, the first is the broke place. And this is a great problem that helps the high number of the people with illness. In this situation, the people can improve the diabetes type 2 and cardiovascular illness. That is not the case for our study. Marmot looked about these the private area, and understand that in these areas are a high number of fast food, gambling, and alcohol shops that all that not help the health of the people. More of these, as you know, might call it, Brent have an eye mixed number of different ethnicity groups. But the two particular groups are more sensible about the diabetes of type 2, and they are the South Asian and Afro-Caribbean population. They have about from 1.5 to 4 times the risk to develop this type of diabetes. And I'm not considered to show that the environment in the present area help to improve this type of illness. And then we have a great number, and for example, in 2024, the UK Parliament showed that the people that live in poor family have about 2 times more higher risk to develop diabetes. Then this is really situation when we have an intersectional problem where the wrong environment, the present economic area, and typical ethnicity group all mixed up give us the very, very important number of this illness. And that our super classmate Irene can explain better without speaking about this.
Okay, now we move to the current issue, and the health issue. We close focus on type 2 diabetes. Diabetes rates in Brent are increasing, and they remain higher than both the London average and the England average, according to Office of Health Improvement and Disparities, 2024. Right now, around 8% of people in Brent are diagnosed with diabetes, but this number does not tell the whole story because many other cases are still the undergoes. To put this in context with real numbers, diabetes prevalence is in Brent is 8.58%. Compare this to London, where it is 6.75%, and in England, where it is 7.26%. So Brent is clearly above both the regional and national average. This is the core problem our poster is exploring, not just that diabetics exist in Brent, which is true everywhere, but that it exists at a noticeably higher rate here than in most other places. And as we saw in this profile section, this is closely connected to who lives in Brent and the condition they live. Why it is issue? It matters first because diabetes put pressures on local NHS services and increase healthcare costs. More people with diabetes means more GP appointments, more hospital visits, and more resources needed. Second, diabetes is not just one condition. It's on its own. It can lead to serious complications, including cardiovascular disease, kidney, heart attack, kidney disease, kidney failure, and blindness. These are life-changing complications that affects people for the rest of their lives. Third, living with diabetes can negatively affect person's daily life and overall well-being, from constantly monitoring blood sugar to managing medication and the emotional stress of long-term condition. And it also put barriers to work, to social life. And finally, type 2 diabetes is more common in deprived areas in such ethnic communities, and this increased health inequalities even further. So diabetes in Brent is not just a medical issue, it is also a social justice because it affects some groups of people much more than others. And now I'm gonna pass to Leg to help in inequality. Thank you.
When we talk about health inequality, we think about everyone gets the same fair shot of a living healthy life. But the truth is, where you live and how much money you make, you can completely control your health. When you see this very clear right here in London, Borough Brent. A few years ago, an NHS report showed a high divide in our community. Deeply rooted inequalities are creating massive barriers for people. These barriers decide who gets a good care and ultimately who gets a live long healthy life. People living in the poorest area of Brent aren't just struggling to pay the bills. They are actually more likely to develop serious illness like diabetes type 2. It gets worse. Once they are diagnosed, they have much harder time managing the illness than people live in wealth areas. They face a steep uphill battle just to get the basic care, resource, and education they need. The proof is right there in the numbers. About the estimated rate in Brent, like Erin said, the shocking is 8.58% have diabetes 2 in Brent. Thinking about that number, nearly 1 in 10 people have this illness. Expert research show us that this high number is not an accident, it's a direct result of local inequality. Prevent and manage diabetes. You need access to affordable health food. You need to have safe green space to exercise, and you need to have time and money to focus on your health before you get sick. When a neighborhood lacks the basic things, diabetes rate skyrockets. That 8.58 rate in Brent is just a medical statistic. It's a sign that our system is failing people. If we truly want to bring that number down and change lives for the better, we can't just hand out medicine. We have to fight the unfairness that caused the sickness in the first place.
Okay, now moving to the provision section, there are several health and social care services available in Brent to help people prevent and manage type 2 diabetes. One of the main services is the Brent Integrated Diabetes Service, BIDS.
Right, 2 minutes more.
According to Brent Council 2023, this service provides advice, education, and ongoing support for people and ongoing support for people living with type 2 diabetes in the local community. It also supports 67 GP practices across brands, helping patients access the right care closer to home. Another important service is the NHS Diabetes Prevention Program. According to NHS England, this program helps people who are at risk of developing type 2 diabetes by encouraging healthy lifestyle changes such as improving their diet, becoming more physically active and managing their weight. People can also use the Diabetes UK Know Your Risk tool. This is a simple online assessment that helps people understand whether they may be at risk of developing type 2 diabetes and encourages them to seek advice earlier. The types of provision, there are different types of provision available. Primary provision includes GP surgeries, NHL's health checks and community support services. This is usually the first point of contact and focuses on prevention, early diagnosis and regular monitoring. Secondary provision includes specialist diabetes clinics and consultant-led care for people who need more specialized treatment. Tertiary provision provides advanced hospital treatment and long-term management for people with complex diabetes and serious complications. And finally, voluntary provision is offered by organizations such as Diabetes UK. These organizations provide the education, information, support groups, and awareness programs to help people prevent and manage type 2 diabetes. Even that brand offers a wide range of diabetes services, there are still some gaps. For example, services can vary and waiting times for